like to present a prospective consecutive AS cohort of 40 degrees and more treated with a Gensingen Brace. So, still today there is no evidence for spinal fusion surgery in patients with idiopathic sclerosis, with many long-term unknowns. Because there is currently no high-quality evidence. Oh, this screen is not on?
No, it's not working.
It's not working, so, okay. Leading on. Okay, with spinal fusion surgery, Ward and co-workers let their patients with curvature beyond 40 degrees decide upon undergoing surgery by themselves. Okay. This evidence-based change of paradigm demands to extend the conservative perspective of treatment also to patients with curvatures exceeding 40 degrees. Therefore, we have started a prospective cohort study with immature patients complying with the SRS inclusion criteria, except the range of curvature being 40 degrees and more. All female patients complying with the SRS inclusion criteria and with curves of 40 degrees and over, treated with the Gensingen Brace, have been followed up prospectively since 2012. 23 patients have been identified having a follow-up period of 18 months or more. Average curvature was 49.4 degrees at the start. Average age, 12.4 years, average risk assigned 0.83. 13 of the 23 patients have been premenarchal at the start of the treatment. The average follow-up time was 28 months. And here you can see the average patient, the maturity at the start and the average patient at the end. Therefore, at the end of our observation period, progression is less likely than at the start. The average cut angle after follow-up was 43.8 degrees, with 2 patients progressing and 9 patients improving 6 degrees or more. ATR, which is the angle of trunk rotation as measured with the scoliometer, decreased from at average 12.8 to 9.7 degrees. So successful treatment of AIS curves of 40 degrees and more was possible in more than 91%, and cosmetic improvement of the deformity was possible as well when using the Gensingen Brace. Here we have a patient from the sample. She came from Norway, didn't want to undergo surgery, and we treated her with this Gensingen Brace. She was very stiff curvature. She had a hard time the first week, but then all went well. And this was an intermediate result, and this is how she still looks today after 2 years of treatment. These were the pictures the mother had sent to me. This was before treatment when they asked for being treated in my office, and this was the intermediate result. And here you see another patient with a huge curvature. She's very immature. You can see this, the head-trunk ratio is immature, and a good in-brace correction, as can be seen here. And after 3 months' time, she is nicely rebalanced. Another example, this is a special design for curvatures, thoracic curvatures exceeding 60 degrees, because we have more access to the rib hump if we put on this oblique strap. Because the brace might rotate because of the strap tension, we have to make an extra pad down here, a gluteal pad as we say, so the brace will not twist. Successful treatment of AIS curves of 40 degrees and more was possible in more than 91% of the cases, which is better than the result as achieved with the Boston Brace in curves between 20 and 40 degrees. Significant reduction of the ATR shows that an improvement of the deformity is possible as well. So this is a graph from Lohenstein and from Nachemsen and Peterson initially, and so here we are with the Boston Brace, here we are with the Chenot Brace in the prospective controlled study, handmade Chenot Brace standard 99, and here we have our cohort with a very high success rate. We have an update of this study right now. We have 2 more patients in this sample, and the results are pretty much the same. And we compared with the Brace study results with the set test, and it was highly significant, the differences between the 2 groups. So this will be published probably this year in Open Orthopedic Journal. Would like to close my lecture with this nice picture. She was not in the study. She came from Boise, United States, and the surgeon had told her nothing and surgery could help her, but she declined surgery. And she came pretty mature at the age of 14 years. Only 1 brace she had because she did not really outgrow this brace. And this was a fine result at 17. And she is very keen, not having undergone surgery, and being able to perform as a wedding gown model, as can be seen here. No? Thank you for your attention.
Right. Are there any questions?